Hello, my name is Mackenzie Rosner, and I'm a nursing student at the University of South Alabama, and today I'll be performing a central line dressing change checkoff. So first, she's going to scan the room. So upon entering the room, I'll perform hand hygiene. I'm going to verify the patient's order and hospital policy. I am going to identify the patient using two identifiers. So I see that this is patient Jaguar Jones, born on 8/25/1963, 8/25/1963, and I see he has an allergy band to penicillin, and that is also on the order form. And so I would also make sure he doesn't have any other allergies, and then I would explain the procedure to the patient and provide privacy. And so now I'm going to assess and palpate around the insertion site if there was a presence of any drainage, purulent odors, or inflammation, or a febrile patient. Then I would obtain a wound culture if indicated. So now I am going to, I would make sure that the bedside table was placed to me, and I would want to make sure that it was at a working height to avoid contamination. And then I would position the trash can and provide hand hygiene. And then I am going to raise the bed to a working height and lower the side rails, and I would make sure that the head of the bed was slightly elevated and the patient was comfortable. So now I'm going to open up the kit and get the mask out. So I'm going to put this mask on, but for the purpose of the video, I'm going to pull it down. And then I'm also going to make sure that the patient has a mask on also. And now I'm going to put my goggles and my gloves on. And now I'm going to remove the dressing from the patient. I'm going to secure the catheter, and I'm going to pull the dressing towards the wound. And I'm going to assess the catheter, the insertion site, and the surrounding skin. And then I would also remove the bias. And now and at this time I would also obtain a wound culture if needed, and I would observe for any signs and symptoms of complications. So now I'm going to perform hand hygiene, and I am going to open up the kit using aseptic technique and only touching the 1-inch borders. So now I'm ready to put on my sterile gloves. So I'm going to keep my hands above my waist, and I'm going to organize my sterile field and make sure everything stays away from the 1-inch border. I'm going to now open up my alcohol swab and dispose this. So with this hand, I'm going to secure the catheter. So now this hand is contaminated, and I'm going to start at the injection or insertion site and go outward in rainbow motions, cleaning the surrounding skin. And now I'm going to dispose of the waste, and now I am going to get the ChloroPrep and activate it, and then I will use vigorous motions, horizontal and vertically, to clean, and I'll do this for 30 seconds. Making sure that my sterile gloves do not touch the catheter or the patient's clothing. Okay, now I dispose of my waste. And now I'm going to apply the bio patch. Okay. Now I'm going to apply the Tegaderm, only touching the paper, and I am going to place this so the insertion site is in the center, and make sure it's adheres to the patient's skin. Then I'll remove the paper surrounding edges, and I'm gonna save it for the label. I'm gonna put this to the side for the label. And so now I'm ready to dispose of my sterile gloves. Glove to glove and skin to skin. I'm gonna remove my goggles and my mask, and I'll also remove the patient's mask. And now I am going to apply my label. Now I want to make sure that the date, the time, and my signature is on it, and I want to make sure that it does not cover the insertion site. So now I'm going to lower the bed to the lowest level, raise the side rails, and make sure the patient's comfortable with the call light in reach. And so now I'm going to dispose of all my equipment, and I'll perform hand hygiene, and I'm going to document. I will document the site of the appearance site, the amount and characteristics of the drainage, if a wound culture was obtained, the type of cleanser, the type of dressing, the patient's tolerance, and the date and time, and my signature. Thank you.